following program on Ada Derana 24 is classified for general audience. It is intended for all ages. It contains little or no violence, no strong language, and little or no sexual dialogue or situations.
Good evening, and you're joining another episode on Business Best, and this is a platform where we showcase the best in the business, and we will be introducing to you people who have excelled in their particular field in order to showcase their latest developments in their respective industry. Now today we are going to talk about a business which is a digital healthcare platform. Now when we talk about digital platforms for Medicare, I'm pretty sure like a lot of applications would be coming into your head right now, but particularly I wanted to get Flash Health today on air because they have come up with new initiatives that would benefit both end users, the doctors who enroll as well as the patients as well, and the users of the app. So with that introduction, I would like to invite Arshad Ameer, who's the founder and CEO of Flash Health. Arshad, thank you so much for taking the time to join me on the show today.
No worries.
All right, so to start off our discussion, I think our viewers would love to know what Flash Health is all about and a little introduction to how it all started.
Okay. So Flash Health is a digital healthcare business. In the most simplest terms, it has 4 service verticals. So we do medicine delivery across the country. We've got home lab tests where we send the phlebotomist to the home, the blood samples collected and the reports available on the app. Then we have something called Raya, which is our wellness marketplace. And finally, First Advice, which is our doctor consultation platform. Now, while these are 4 simple services that you see, this has a lot of research that's gone behind. While we've set up the business here in Sri Lanka over the last 3 years ago, this is not our first rodeo. We've actually done this back in Bangladesh, where we built the largest digital healthcare platform, went from 0 to 6 million plus customers. There was a massive amount of learning doing that there, especially given the fact that the population only had a literacy rate of 24% there at the time, and we had to go through a humongous amount of behavior change exercises in order for them to adopt a digital healthcare service. So it's all those learnings after coming back to Sri Lanka is what resulted in Flash Health, which is version 2.0.
All right, so why did you want to come up with this idea in the first place?
That's an interesting question.
And also, as I mentioned in the intro also, it's when you talk about healthcare apps, like there are so many here in Sri Lanka also that has been used. So how do you deal with the competition also?
Great. So this actually when I was doing this whole Bangladesh traveling back and forth at the time, my parents were back here, and I always was running around when I got back here to take care of their medication or anything to do with their healthcare, and it always kept making me think, like, why isn't anyone solving this problem? I'm sure I'm not the only one who's going through this, and it kind of stuck with me. So when I got back after my entire consultation there, I realized that there is an opportunity in the market here, because if you see the competition, they do things in silo. So you take either they're doing medicine delivery, or they do doctor consultation, or they do the lab services, but all of them work in silo. There is no cohesive ecosystem that connects everything together and just gives one service, one platform for the patient to access. And this is what I think Flash Health solves massively.
All right, so providing all of these services under one roof, wasn't it difficult to getting the team together? And especially I think Flash Health is doing delivery island-wide as well.
Yes, it's been a tough journey, I'm not gonna lie. Like any startups, we had to go through the hardships, but the vision of disrupting the primary healthcare space has always been the goal. And when you have the vision clear and the goals set in line towards getting there, you start attracting the right people and the right mindset. And in that angle, I've been blessed to make sure that we got the right team on board who kind of works really hard. They're burning the midnight oil to make sure that we, 1, deliver an amazing experience to the consumer. 2, we deliver this service across the country. And 3, we are truly disrupting the healthcare space.
All right, so when talking about delivery island-wide, do you all provide to the topmost level Jaffna as well?
Yes, we do. So today in our platform, you can get medications delivered all the way to Jaffna for just 650 rupees. within a span of 3 days. Now, it's not going to be a case like, you want Panadol and you can just walk to the pharmacy next door. But think of a use case where you need medication, antibiotics maybe, and that's not available in Jaffna. You're not going to expect them to come all the way to Colombo now, are you? So that's where Flash Health comes into play. They can simply place the order on the Flash Health app, and they can track where their order is, and within a span of 3 days for a cost of 650 rupees, it's delivered.
That's amazing to hear, because now with the fuel crisis also, I mean, it's hard to maintain a price at that level, but then it's glad to hear that, you're managing it that well. How do you cope up with, delivering it within 3 days' time? Do you have the base for it, your drivers and the delivery capacity?
Yeah. So when it comes to Colombo suburbs, Nigambu, Kandy, we've got our own fleet where we kind of deliver it. And the reason we use our own fleet is because, one, we have to make sure that we deliver the promised times. Two, the medication that goes out is correct and it's not being tampered with. And three, just keeping to our word, the SLAs, right? But when it comes to delivering to the more wider area of Sri Lanka, we work with trusted partners who can adhere to the clinical, medical delivery standards. So we work with them. We've got to a point, where the trust is established between both parties. They know the importance that it's medication being delivered, not goods. So with that, partnership and trust, we've always made sure it's delivered within 3 days. And because there's volume, we can bring the cost down. And the entire ideology of Flash is not after the money, because we believe high quality healthcare should be accessible at affordable rates. So for those reasons, for us, 650 rupees is more than enough to get the medications delivered.
All right, now the accessibility to medicine is also becoming difficult now in Sri Lanka as well. So how have you partnered up with different medical suppliers in order to have the availability of your resources?
Yes. So we do this on two fronts. One, we rely heavily on data. So we've got trends of what medications are being consumed by patients. So we kind of have a forecast of what's going to be in demand, what the supply is looking like, and do we have them in stock. In the event that's not there, we work with the suppliers to say we need these beforehand. And in that front, we were able to mitigate much of the issues around lack of medication availability.
So describe a little bit about your user base also. Now you all started this off in 2019.
Yes.
And how has the response been so far? When you all first initially started and till today?
It's been an amazing response and something that's satisfying, to be honest. Early days when we started, we didn't want to be the platform that would just put up a form and say, upload a prescription and we will deliver medicine. Because I think there were people already doing that. For us, it was more about understanding what were the pain points of the consumer. So we literally rolled up our sleeves, we went onto the streets and started doing the delivery. And identifying what were those actual pain points and how can we really build technology around that to make it much, much more friendly. So with that in mind, every time that we get an order now, there is a 76% chance that they're going to stay with us. And the market standards when it comes to retention is just 22%. So that stat alone, I think, speaks volumes in terms of what the adoption has been like for the app.
How do you make sure that your clients are sticking with you all throughout?
So one of the learnings that came out of the whole Bangladesh experience was that if you do not engage with your consumers, they are going to forget about you. You just become another app that's sitting on the 5th page, right? So we thought really hard how we could, incentivize customers to be engaging with us. And we came up with this concept called move, burn, earn. In the most simplest terms, we pay you for walking. And it's tiered in 3,000, 5,000, 7,000 and 10,000 steps. You get money added to your wallet in real time, and you can accumulate that up to 300 rupees over a month. It's not a lot of money, but no one is giving that free right now, yeah? And the idea behind that was also not just having them to engage, but also if you are staying healthy, healthcare should be a bit more cheaper for you because you're putting in the effort. So with that concept, we were able to get the stickiness. We call this product stickiness. Coming along for Flash Health.
Oh, that's amazing. Y'all have come up with a concept to encourage people to walk also per day, because people can be really reluctant to do some exercise, and it's it's imminent that people do some exercise or actually some physical activity per se. And I'm glad that Flash Health is taking this initiative. And why not? You're getting a few extra bucks. Why not just go for a walk, right?
Exactly. You're doing it anyways.
Yeah, exactly. So how do you plan on expanding this business now? Are y'all just providing this service in Sri Lanka per se?
So Sri Lanka has always been our test operational bed. Our plan is to lift and shift this model across other low and medium income countries. So like the neighboring India, Pakistan, Nepal, Bangladesh, Maldives. We've got a huge market out there that kind of has the same problem that Sri Lanka faces around primary healthcare. So the plan is always to lift and shift it, and of course there's going to be cultural changes in those areas which we will adopt to, but the vision of disrupting the primary healthcare space is always going to be the same.
Okay, Arshad, so we need to continue this discussion as well, but before that we are going into a short commercial break. Stay with us. Welcome back to Business Best, and we were in discussion with Arshad Ameer, who is the founder and CEO of Flash Health. Arshad, in the first segment you gave an introduction to what Flash Health is all about and the core competencies that you all have, and also about we left off when talking about expansion into other countries. Right now, do you all have Flash Health operating in other countries as well?
We are in the process of doing the feasibility study. So Maldives has been a market that we are looking into, because they've got a genuine problem in terms of medications being refilled at these resorts. You pay $20,000 to spend a night there, and then if you don't have medication in the event you need it, it's a problem. We're also looking at the Indian market, because if our app makes sure it's taken a different approach in terms of how we solve the problem for the consumer, right? If you see other healthcare apps and Flash Health, we use something called a design-led thinking approach of how we deliver the service. So it's not about what you see on the app, it's the experience that you're going to gain out of it. So with that in mind, the Indian market has a massive void of giving a rightful experience on the healthcare front. So Flash Health on that front can easily fill that void. So India, Maldives are the two countries that we are looking at really.
Okay, now coming back to the user's point of view, what are the benefits that the user can gain by enrolling with the Flash Health or downloading the app per se?
Yeah, so while I explained the 4 service verticals, so we've got medicine, we've got lab test, Raya, which is a wellness marketplace, and First Advice, talking to the doctor, and we've got Move Burn Earn. Now, while you see these 5 services just in silo, they're actually solving an underlying problem. And that's what another goal of Flash Health is all about. If you take the Sri Lankan healthcare today, none of our health records are centralized in one place, and that is a problem. And that is a big differentiating factor of the high quality healthcare that we say that's in the West versus what we have here. And it seems like no initiative has been taken to solve that problem on a more larger scale. So Flash Health today, as you are using these services in silo, it aggregates the data and it's structuring it for you as your own central health record system. It's called a personal health record system. And this is done free of charge at no cost, and the data is yours. Privacy is built within itself. And when you talk to the doctor on our First Advice platform, the doctor will have access to these data subject to you allowing it because of the privacy element. But imagine where you're talking to the doctor, he already knows what your diagnoses were from the historical records. He knows what your results are from your lab reports. He knows what medication you're on. He knows how active you are. And better yet, if you're wearing a smart wearable like an Apple Watch or a Google Fit, it's going to streamline vitals to the doctor in real time, so you don't need to be physically present next to the doctor. So it's like giving a real-time experience of like being next to the doctor while you're sitting in Australia or Dubai to get a consultation.
All right, so these consultations can be done online as well?
Yes.
You don't have to physically go?
No.
Oh, that's great. So when talking about the other services, now we spoke about the customer point of view. The main reason which I came into this point was about the privacy and the security concerns. Now when it comes to healthcare, like a lot of people would not like their personal details to be publicized. Now when their details are recorded in this application, obviously the doctor needs to look into your personal medical healthcare details, but then can we choose what and what not the doctor can see? Because for example, if I am reporting to Dr. A, I might want to shift to Dr. B. So, but if the doctors are having a conflict with between each other, it's very common in Sri Lanka,
yes,
right? They have little conflicts against each other. So, can I choose like which information the doctors can read?
Yes, so we've made sure that privacy is built into the platform from the get-go itself. You control who sees what of your data. So for an example, even on this move, burn, earn that I explained you about, where we pay the consumer, we've built a leaderboard. It's a public leaderboard, but we've given the user the choice to be a part of that leaderboard or not. It's your choice as to who sees that data. And that leaderboard is just a more gamified concept where you can compete and who does more number of steps. And we incentivize them for being healthy by giving them free health checkups. But then again, the privacy is there. It's in your fingertips. Even when you're talking to the doctor, you get to say what records you show to the doctor. And even the vitals, the doctor will have to request access from you and you have to allow it. So the control is always on the consumer's end.
Right, okay. Now coming back to the doctor's point of view, what benefits do doctors have and how can you encourage them to engage with Flash Health?
Yeah, so for doctors who are running a clinic, right, so I think it's quite an operational nightmare for them given the fact that they are also visiting other hospitals. For them to run a clinic, they're going to need resources, manpower to do that. So we came up with a concept called virtual clinic. This is where a doctor can run their entire clinic on the platform. So how this would work is patients would set appointments with the respective doctor they want to meet. The appointments get scheduled into the virtual clinic platform itself, and it's on the Flash Health app for the doctors. It's as similar to what they would use the app for to get medicines delivered. So they don't have to maintain two separate apps. So there they would see the appointment come in. On that time, the app kind of reminds them that there's an appointment. They would just log in. It's like logging into a Google Meet consultation. It's very, very simple, but you do it through the Flash Health app. We've built the entire thing in-house so that it's all secure. Your data doesn't go out. And as you're doing the consultation and the doctor prescribes you or diagnoses you with some symptoms, he's just going to type that in and end the consultation by prescribing the medication as well, right? So what the platform automatically does is it records the patient's data in a structured manner instead of the doctor having to do it, and it all files it in digitally. So the doctor never has to lift a finger on that. And for the doctor also, the medication gets delivered by us, right? So they prescribe it, and they have the choice to say that either you get the prescription only, which is not a problem, or you can get the medicines delivered right off itself. And for that, the doctor could leverage the medicine vertical and the lab vertical why the Flash Health has. So they don't even need to maintain medication stock or write lab reports separately. It's all done in one platform. It's structured in one platform. And later down the line, if that patient was to call you out of the blue and say, "Doctor, I'm having a problem," and you want to access their records, just open the phone, go to the patient, and request the access. They're going to allow it. View it, just like that.
Wow, that is super convenient for both end users, the
Yes.
client, as well as the doctors as well.
Yes.
So have you had clients who have gone abroad and used Flash Health as well in order to contact their doctors here in Sri Lanka?
Yes, that's been a unique use case that's happening. People who've actually gone abroad who wants to talk to the doctor in Sinhala most of the time. It's nothing like explaining it in your mother tongue. So they've actually called the doctor, requested advice, and medications have been prescribed, and it's actually been delivered from here itself. We piloted a scenario out of this, and one of the customers actually got medication delivered all the way up to UK.
That's amazing. So it's a free way for all the end users as well, as I mentioned earlier. And it's a good advantage for the people who go abroad. Sometimes it's very difficult to find the medicine that we want in other countries. And personalized advice from your home doctor as well. That's
Correct.
amazing. So Arshad, as a businessman, what was the main challenge that you went through when starting up this business, especially in Sri Lanka?
I think the ideology change was a bit of a struggle, because today we live in a world where the healthcare sector has a service-centric model. And we've been told it is what it is, and nothing much could be changed around it. We've gotten, it's kind of gotten complacent. Whereas Flash Health is more on the customer-centric front. We're putting the customer back on the focal point and bringing the services all around. So to get that idea across to people was not an easy thing. It's taken time, and we have gotten to a point where we're getting better at getting the message out. And I hope this will spread wide across soon.
All right, Arshad, we are moving into the end of our program as well. To end of our discussion, you mentioned something very interesting before we came into the program, the new innovation that y'all are working on, where y'all are planning to deliver medicines via drones, and y'all are currently working on that. So tell our viewers what we can expect in the future from Flash Health.
Yes, so today in Flash Health, from talking to the doctor to getting medicine delivered using our express service, you can get that done in 2.5 hours. We intend to bring that down to 30 minutes because we live in a world where pizza is delivered in 30 minutes. It's only fair healthcare has been given equal privilege. So that's what they can look forward to. And the idea is that we will deliver medicines via drones. So talk to the doctor, and within the next 15 minutes, so talking to the doctor will take 15 minutes, and within 15 minutes you will get the medicines delivered. That's the idea.
That's great. Thank you so much, Arshad, and we hope that this innovation would be a success in the future as well. And that was our episode on Business Best. We will be back again next week with another product or service that would interest you. Just in case you couldn't watch us on air, you can always rewatch by catching us on our YouTube channel, youtube.com/Derana English. I'm Suzanne Shinali. Stay safe and have a good night.